exhausted from just climbing a couple of stairs. Unfortunately, this is the reality of people living with iron deficiency. Hi, my name is Aparna, and today I'm going to represent my group B, pathology, and we are going to overlook an important topic, iron deficiency anemia, a common yet often unseen. IDA is not just a feeling about being tired, but can also hinder an individual's quality of life if not treated properly. In this presentation, we are going to see its causes, symptoms, pathogenesis, and laboratory diagnosis with the help of a drama and other means. Scene 1, at the home, performed by mom, Andesha, father, ethics, and son, Abhinesh, who is a medical student.
एक्कासी चक्कर लाग्यो बाबुले उडाउनु न
छोरा यहाँ छोरा आज त छिटो के गर्नु भयो मेरो त मम्मीलाई के भन्छ
नारी नारी नाप्लाको बाटो
मम्मीको कल छैन त कल छैन भने मम्मी त गरिस् अनि के गरिस् त देखाएको छिटो हस्पिटल लिएर जाऊ सुन हस्पिटल
गाडीमा हुनु न एउटा मात्रै छोरा हो
Scene 2, at the hospital, performed by compounder Harsh.
नमस्ते
नमस्ते नमस्ते। क्या है, सुबह से तंग कर दियो, एक जाता है एक आता है, बताओ क्या हुआ?
मम्मी को डॉक्टर को दिखाना है।
नाम बताओ।
पूनम देवी,
उम्र
38 साल।
200 रुपए दो, जाओ 3 नंबर में।
200?
हाँ 200।
इतना महंगा कब से हुआ?
250 है, तुम मेरे से 200 ले रहे हैं।
लूट रहे हो तुम लोग।
Scene 3, at the clinic, performed by Dr. Vipul and interns Archana and Vibhu.
नमस्ते डॉक्टर साहब।
नमस्ते
के हजुरलाई
मम्मीलाई गाह्रो पर्छ नि।
ए बस्नु न ए बस्नु अनि के भएको छ र हजुरलाई
डाक्टर साहेब यति काम गर्छ थकै लागिहाल्छ बुढेसकाल भने बल्ल 48 वर्ष खाना यति खान्थे पहिला जवानीमा अहिले आधा घटेर यति भएको छ सिडी पनि चढ्न सक्दिन सास फुलेर यस्तो हुन्छ सर के गर्ने होला
ए डाक्टर साहब, मम्मी लेजी हुनुभएको छ त।
ए लेजी हो कि लेथार्जिक भएको के गर्छ तिमीले
ए म त एमबीबीएस गर्छु सेकेन्ड इयर।
यही पढिरहेको छ तिमीले
माइनोरिटी कलेज।
यहाँ पढिरहेको छ त के भन्छ यही पढाइ भइरहेछ
एमबीबीएस गर्ने सर्टको कलेजबाट।
ए अनि तपाईको कपाल पनि झरिरहेछ र
पहिला डाक्टर साहब यति बाक्लो ऐश्वर्या राय जस्तै थियो अहिले मुसाको पुच्छर जस्तै भयो यस्तो गर्दा पनि झर्छ
ए अनि तपाईको चाहिँ म हेर्छु एक चेक गर्छु आँखा देखाउनु न आफ्नो म आफै गरिहाल्छु एकचोटि जिब्रो देखाउनु त आफ्नो राम्रो छ निकाल्नु न ए अनि हात देखाउनु त ए नङ पनि देखाउनु एकचोटि ए एकचोटि फेस हेर्छु हजुर ए के लाग्छ तिमीहरूलाई के होला उहाँ
उहाँको फेस पनि सेतो पेल जस्तो देखिन्छ अनि सिम्टम्सहरू पनि हल्का एनिमियासँग म्याच गरेको देखिन्छ पक्कै पनि एनिमिया भएको हुनुपर्छ
के हो यो एनिमिया भनेको डाक्टर साहब
ए एनिमिया भनेको हाम्रो बडीमा रगत हुन्छ नि त्यो रगतमा आरबीसी भनेर हुन्छ के
आरसीबी
हैन आरबीसी हो त्यही आरबीसी को कमीले गर्दा रोग लाग्छ त्यो रोगलाई हामीले एनिमिया भन्छौँ के एकचोटि एनिमियाको बारेमा राम्ररी एक्सप्लेन गरिदिनु त
Anemia is a condition characterized by decrease in total circulating red blood cells, hemoglobin concentration, and hematocrit below normal level for particular age and sex. While talking about the classification of anemia, morphologically it can be classified into 3 major types. First one is microcytic hypochromic anemia, second one is normocytic normochromic anemia, and third one is macrocytic normochromic anemia. While pathologically, anemia also can be classified into 3 major groups. First one is anemia due to increased blood loss. Second one is anemia due to increased RBC destruction. And third one is anemia due to decreased RBC production.
अनि तपाईले अब हामीले के गर्नु पर्ला भन्नु त एकचोटि
ब्लड टेस्ट र पेरिफेरल ब्लड स्मेयरको लागि चाहिँ ल्याबमा पठाउँ अनि रिपोर्ट आइसक्यो
seen after lab report.
तिमीलाई हातमा भएको रिपोर्ट हेरेर एकचोटि के भयो?
उहाँको पेज र ब्लड स्मियर अनि ब्लड टेस्टबाट चाहिँ थाहा हुन्छ कि उहाँको आइरन लेभल पनि कम छ, नर्मल लेभल, अनि सिम्टम्सहरू पनि म्याप गरिरहेको छ। पक्कै पनि आइरन डेफिसियन्सी एनिमिया भएको हुनुपर्छ।
के हो र आइरन डेफिसियन्सी एनिमिया? कलेजहरूलाई एक्सप्लेन गर त।
Iron deficiency anemia is a condition in which body doesn't have enough amount of iron for adequate hemoglobin synthesis. Hemoglobin is a protein required for transport of oxygen in our blood. Iron deficiency anemia is the most common nutritional disorder in the world, and it is a microcytic hypochromic anemia. While talking about the causes of iron deficiency anemia, it can broadly classify into 4 major groups. First one is chronic blood loss. Second one is increased need of iron. Third one is inadequate intake of iron. Fourth one is impaired absorption. First cause, chronic blood loss, mainly in some conditions, uterine conditions like postmenopausal bleeding, heavy menstrual bleeding, and repeated miscarriage, as well as in some GI conditions like bleeding from peptic ulcer, hookworm infection, iron deficiency anemia. So conditions like pregnancy, lactation, body needs extra amount of iron, as well as in children and adolescents during their period of rapid growth, body requires extra amount of iron. If these needs are not fulfilled, the level of iron in our body will be low and leads to iron deficiency anemia. The third cause is inadequate dietary intake of iron, or diet that lacks iron-rich foods such as green leafy vegetables, red meat, and beans, leads to deficiency of iron, especially in those who are vegetarians and people with poor eating habits. Last cause for iron deficiency anemia is impaired absorption in some GI conditions like celiac disease, partial gastrectomy, and acrohydria. Body's ability to absorb iron decreases and leads to iron deficiency anemia.
तिमीले चाहिँ प्याथोलोजी एक्सप्लेन गर त।
Before talking about the pathogenesis, let's first of all talk about iron absorption and its story. As we can see here, the food we consume contains iron in two forms, heme iron and non-heme iron. The heme iron is absorbed by duodenum through heme transporter, while non-heme iron, which is present in the ferric form, is first converted to the ferrous form, which is then transported to the enterocyte through DMT1 transporter. Now, inside the enterocytes, what happens is the iron either is stored in the form of ferritin or is transferred to the RBCs or blood through ferroportin. So, now let's talk about the factors responsible for pathogenesis. There are 4 factors: impaired hemoglobin synthesis, impaired cellular proliferation, diminished iron-containing protein, and reduced red cell survival. First, talking about impaired hemoglobin synthesis. Since iron is the main component of heme in our body, with less iron, the hemoglobin synthesis is impaired in great amount, causing microcytosis and hemochromic condition. Now, secondly, impaired cellular proliferation. With less iron, the cell proliferation decreases greatly, causing less cellular proliferation, and erythroid progenitors also fail to proliferate the cells to the bone marrow. Now, third, diminished iron-containing proteins. The iron-containing proteins and other enzymes such as cytochrome oxidase gets decreased due to the deficiency of iron. Now, lastly, reduced red cell survival. Normally, the lifespan of RBCs is 120 days, but due to decreased iron in our body, the RBC membrane lysis and other factors such as decreased oxidative phosphorylation, we can see the red cell survival rate decreases greatly. Now let's talk about the stages of anemia. Stage 1, iron depletion. Talking about the iron depletion stage, it is a stage where the stored form of iron, that is ferritin, decreases without any decrease in the RBC and hemoglobin, since the ferritin compensates the loss of iron in our body. Now let's see at the figure. At normal condition, we can see the serum ferritin hemoglobin is not in their normal position. But while talking about in stage 1 iron depletion stage, the serum ferritin has decreased, but hemoglobin is still in its normal form. Now let's talk about the stage 2, iron deficient erythropoiesis. In this stage, the iron transport to bone marrow decreases, due to which there is anemia and hypochromia. But in this stage, hypochromia is still not detectable, while the ferritin is greatly decreased. As we can see in the figure, there is great decrease in the ferritin. It is completely depleted, while hemoglobin is still in its normal position. Now, finally, stage 3, which is iron deficiency anemia. While talking about stage 1 and stage 2, these stages are considered to be mild. But while talking about the last stage, it is severe form of anemia, where we can see there is complete depletion of ferritin as well as RBCs, and hemoglobin also decreases in great extent, causing microcytic and hypochromic anemia. Looking at the figure, we can see there is already the ferritin has depleted and hemoglobin and RBCs has also decreased.
अनि ल्याब डायग्नोसिस पनि अलिकति भन्दियो न म भन्छु right, talking about the laboratory investigation of IDA, we can broadly classify it into 3 subheadings. One is routine RBC parameters, one is microscopic examination, one is serology. Here, pathology, we'll be focusing on microscopic examination. Let's see peripheral blood smear. In peripheral blood smear, we can see RBC as microcytic, that is small in size. Then we can see RBC as hypochromic, that is pale color. And then we can see RBC also in anisocytosis, that is varying size, and poikilocytosis, that is varying shape. We can also see in the diagram that RBC are of pencil shell type and teardrop type. We can also see RBC as hypochromic in this. We can also do laboratory investigation for bone marrow, which is not performed usually because it is expensive. Within bone marrow findings, we can see cellularity of the bone marrow is increased, myeloid erythropoid ratio is decreased, erythropoiesis is increased. We can also do Prussian blue reaction in these cases, in which we can see this is a positive test for the Prussian blue reaction. The blue dots we can see in the diagram denotes that there is an iron. And in the case of IDA, here you can see there is no such blue dots that denotes that there is no iron in the case. So that denotes IDA case. यति गरेपछि के लाग्छ मलाई केले गर्दा होला र
हजुरले माछा मासु कतिको खानुहुन्छ हप्तामा खानुहुन्छ कि खानुहुन्छ कि खानु हुँदैन कि
माछा मासु त किन नखाने हो र हप्ताको एक दिन चाहिँ यसो छोराले ल्याउँदा खान्छु
अनि हजुरको चाहिँ महिनावारी हुँदाखेरि ब्लिडिङ कतिको हुन्छ त्यो पनि जान्न पाए हुन्थ्यो
दिनमा महिनावारीमा त वाल्ती हुन्छ नि रगत त्यस्तो बग्छ डर लाग्छ अहिले पनि मेरो महिनावारी चलिरहेछ गाह्रो हुन्छ डक्टर साहब मलाई
पक्कै पनि अब महिनावारीमा एक्सेसिभ ब्लड लस भइरहेछ उहाँको अनि आइरन डेफिसिएन्सी एनिमिया पनि महिनावारीको कारण पिरियड ब्लड लसको कारणले भइरहेको हुन्छ
म हजुरलाई ती आइरन सप्लिमेन्ट्सहरू लेखेर दिइदिन्छु त्यो आफ्नो टाइममा खानु होला टेन्सन नलिनु आइडिया भनेको एकदम कमन कुरा एनिमिया हजुरले भन्छ हजुरले आइरन सप्लिमेन्ट्सहरू खानु हजुर सक्नु खानुहरू खानु होला हजुर सिधै सिकाउनुहुन्छ तर 15 दिनमा फेरि फलोअप पनि आउनु होला है